Also for us tonight, we know a lot of you watching have pets. And just like humans, pets need checkups, they have medical issues, health emergencies. That is, of course, where a veterinarian comes in. The thing is, getting to see a vet isn't that easy these days. This post caught our attention from the Veterinary Emergency Clinic in Cheektowaga. That organization says between 2019 and 2011, the number of pets in the U.S. grew by 48 million. In that same time, the number of veterinarians grew by just 3,000. That means we went from having one doctor for every 1,080 pets to one doctor for every 1,450 pets. Joining us live right now to talk about this is Dr. Stephanie West, Executive Director of the Veterinary Emergency Clinic. We really appreciate you taking some time. I mean, when we saw those numbers, it was almost like we wondered if we needed to double check them to see if they were actually real. I mean, how acute is this problem right now?
This is one of those problems that we can blame on the pandemic. It may have been started beforehand. People like animals and more people get more animals. But we also know that during the pandemic, there was a loss of veterinarians and veterinary staff. So some people retired, some people passed, some people just got out of the profession. And a lot of people that were stuck at home decided to join their homes with a pet. So we had an increase in pet numbers exactly when we had a decrease in veterinarians and staff.
And so, Dr. West, what needs to change to fix this, right? I think people at home are looking at this and saying, okay, yeah, we definitely need more veterinarians. I assume it's easier to say than actually get done.
Yes, so to become a veterinarian, you need a 4-year college degree, then 4 years of veterinary school, and it takes a long time. So if we said today that you wanted to become a veterinarian, you would not be a veterinarian until for 9 years. So it's not a quick fix, but what pet owners can do is know that ahead of time, know that they can plan their veterinary care, and hopefully do a lot of preventive care and avoid having to come to our emergency clinic. We would love to see you if you need the emergency, but we really hope that you don't. And scheduling your preventive care with your veterinarian well in advance is a helpful action.
Yeah, you really do have to prioritize when the numbers are what they are. So long term, obviously the goal is to do some of the systemic changes like you're talking about and get more people into the field. But what happens in the short term? I mean, besides, pet owners kind of being smart about when they take advantage of these services, is there anything else that can be done here?
Well, one thing is patience, and I mean patience as in the virtue, not in terms of our client, a veterinary patience. But unfortunately, there will be a wait time if you do need to see a veterinarian. For our emergencies, the wait time can be hours to even days. In some area, veterinary emergency hospitals across the state and other states have closed. There's been about at least a 30% increase in emergency caseload. And that means the most serious emergencies get seen first. So things that you would consider an emergency have to wait. It's just terrible. So anything that people can do to keep their animals healthy, prevent them having to come, and then if they do come to an emergency hospital or your veterinarian, be very patient, be kind. The staff is doing everything they can. They are working like crazy. My own staff had a 65% increase this summer in caseload, and they still managed to be smiling and happy and caring for their patients. So being kind, understanding that this wait is not, it's just something we're trying to get through.
Yeah, kindness can go a long way in a situation like this. Dr. Stephanie West, thanks so much for taking some time for us. Executive Director of the Veterinary Emergency Clinic. Best of luck to you as you navigate these tricky times.
Thank you.